Hi, wishing all of you a very happy Diwali. I know you're all studying very hard. Today's reel is basically a very important topic which has come repeatedly in the exam, that is evaluation of a girl with primary amenorrhea. Now I've divided this into two parts to simplify things. If a girl comes to us with primary amenorrhea, the first thing that needs to be done is to look for the presence or absence of secondary sexual characters. The absence of secondary sexual characters means that the estrogen level in the body is low. So if she comes with absent secondary sexual characters, look at her height. That's the first thing that needs to be done. If her height is short, think of Turner syndrome, that is 45XO, which can be confirmed by a karyotype. If her height is normal, then we think of problems in the hypothalamic pituitary where the FSH-LH levels will be low, or problems in the ovary where the FSH-LH levels will be normal. So what do we do next? If the secondary sexual characters are absent, height is normal, look at her FSH-LH. If it is low, think of hypothalamic pituitary causes like Kallmann syndrome. If it is normal, think of ovarian dysgenesis. Now, ovarian dysgenesis could be two types. Based on the karyotype, it could be 46XX or 46XY. A 46XY gonadal dysgenesis is known as Swyer syndrome. So, this is very important to remember. So the next scenario is a girl with primary amenorrhea and she has secondary sexual characters present. So what do we do next? The next thing we look for is the presence or the absence of a uterus. This can be done by clinical examination or by doing an MRI or an ultrasound via imaging, that is via imaging. So if she has a uterus, so secondary sexual characters present, uterus present, what do we think of? We think of an outflow tract obstruction, either a transverse vaginal septum or an imperforate hymen. But if the uterus is absent, then we think of two things. This could either be Mullerian agenesis or Mayer-Rokitansky-Kuster-Hauser syndrome, or it could be androgen insensitivity syndrome. And we differentiate between the two by doing a karyotype. So primary amenorrhea with secondary sexual characters with an absent uterus, what do we do next? We do a karyotype, and this will help us determine what it is. If it is 46XX, it means she has Mullerian agenesis. If it is 46XY, it means she has androgen insensitivity syndrome. So this is how we differentiate or we evaluate a girl with primary amenorrhea. You can have a look at the flowchart to understand this better. If you have any doubts, please write them in the comments section. And happy Diwali once again.